Ellie Mae. My name is Hope Gribble, and I'm going to be your student nurse today. Hand hygiene. Alright, so if you don't mind just telling me your name and date of birth.
Ellie Mae Smith, 07/11/1964.
Okay, perfect. Thank you so much. So today we're going to be inserting a Foley catheter, and that's just because your blood pressure has been on the lower end, and so we just want to make sure we're monitoring that and monitoring your urine output. So that's what we're going to be doing. So first off, to even start off, I'm going to actually raise your bed up just to be able to be at working height, so it's easier for me. So I'm going to raise you up. Now I'm going to lower your rail down just so I can easy access you. Let's see. And now I'm going to ensure privacy, so I'm going to completely wrap the curtain around. And don't worry, no one will come in during this procedure. I know it's a little bit uncomfortable, but we'll try to make it the most comfortable we can for you. So first off, I'm going to go ahead and ask you if I can remove some of your covers, just so I can easy access the area. Okay, so now I'm going to do some hand hygiene, and we're just going to make sure you're in the most comfortable position possible. So if you can just lift up your legs a little bit, and you're going to feel a little bit of pressure down there. We're going to be inserting a little, it's like a little bit of a tube, and that's just going to be easier to let your urine out so that we can monitor it easier. And if you feel too much discomfort, just let me know. It might be a little bit uncomfortable, but we're just going to try to make it work the best we can. So I'm going to do hand hygiene. I'm going to put my gloves on. These are my non-sterile gloves. I'm just going to put these on just to make sure being as clean as we can be. So I'm going to take my kit and just set it there in the middle, and I'm going to be using the wrapping that the kit came in just for my trash bag purposes. Set that there, and then I'm going to be taking these gloves here just so I can have them ready. So now I'm just going to take this and drop it, this side, and drop it, this side, drop, and then this side, and drop. Okay, so now I'm going to be discarding these gloves and getting my sterile gloves. I'm going to roll up my sleeves. So now I'm going to do hand hygiene. I'm going to come over to my sterile gloves. Hopefully you can see them. I'm going to be remaining on my 1-inch border so I don't contaminate anything. See, this might be so you can see it better. Okay, so technically this would be unsterile, so I'm just going to act like I'm redoing it. I'm just going to fold it back up and put it here. So this is now sterile again because I messed up, so I'm just going to insert it like this. Slide my hand in. Okay, so now I'm going to keep them away from my body. Okay, so now we're going to be placing down the sterile field that we're going to be working with. So I'm going to be taking this shiny side down and dropping it. I'm going to move this back. And I'm going to be taking this part to drape over the area, drop it. So now I'm going to be taking this down a little bit. Taking my stuff out. Now I'm going to be grabbing this just so that it doesn't go anywhere. It's remain sterile. Taking this and dropping it into the trash. This came out. That technically is breaking sterile food, but we just don't have a lot of room up here. So I'm going to keep this in this hand, and I'm going to take my lube. It's already been opened, but I squirted it in here, and I'm just going to drop the catheter in there just so that I can lubricate, just so that it's a little bit easier inserted. Take that and drop it. Drop that in there. And now I'm going to be taking my swab sticks to clean. So this is the part where I would be breaking. I'm going to be technically taking this hand and make it non-sterile, but before I even do that, I'm going to make sure I test the tube just to make sure that the balloon works. I'm going to hook this part up and just make sure the balloon in fact does work. So I'm just going to let this back inflate that and just set this here and make sure it's sitting in the lube. I'm going to pull this out just so it's easier accessible for me. Alright, so I'm going to take my swab sticks, and I'm going to start by cleaning from top to bottom and the furthest part away. And so this is the point where I'm going to make this hand become unclean. So I'm just going to separate, it's easier. I'm going to wipe from top to bottom for the furthest away from me, from the labia furthest away from me. And I'm going to take this and go around the sterile field and drop. And I'm going to take this next swab stick and do the closest labia to me from top to bottom, go around the sterile field and drop to the trash. And now I'm going to be taking the last swab stick, top to bottom, down the middle of the meatus, and then take it around and then drop. And now I'm going to take this, go around and drop it. Okay, so now that it's all clean, we're going to be inserting a catheter. So I'm just going to be taking this with my one hand. Still remaining, this hand is dirty, so first I'm going to insert it about 2 to 3 inches. So go ahead and insert it. And I start to see urine output, so that I know it's working. So then I'm going to insert it. Then tell Miss Ma'am inserting it another 1 to 2 inches. So I insert another 1 to 2 inches. And now I'm going to infuse the balloon. I'm going to take this and drop it down. And then I'm going to slightly tug back, and I feel gentle resistance, so I know that the balloon is inflated correctly. So now I'm going to take this and strap it to the leg, breaking the sterile field now, strapping it to the leg. I'm also going to take this and hang it below the level of the bladder, but it's not going to be on the bed rail or anything. It's going to be on the bed frame, so I'm hooking that on there. But for the purpose, I'm just dropping it because I don't have anything. And then I would discard of all of this and just get rid of all this, take off the gloves. But now for documentation purposes, I would document that the urine output was an amber color and it was clear. I inserted a 5 milliliter catheter, and I also infused a 10 milliliter for the balloon, the little saline solution in there. And also the patient didn't have much but a little bit of mild discomfort, so that's what I would document as well, and that they were very cooperative with the procedure, and that the catheter secured to the leg, and that the the urine bag is connected to the bed frame. The end.